We're going to give you all an opportunity to review and reflect on these findings from needs assessment calls in both a group discussion as well as in breakout rooms, whichever you prefer. We'll get there later in the presentation. And then we're going to debrief these findings and verify, correct, expand upon what we've learned, as well as give you all a chance to share out any priorities that you feel are in the field as of right now, effective means of structuring our programming, and other suggestions as they may come up. And lastly, we want to focus on creating a space for you to connect, network, and conceptualize what this may look like in the future. So this is our first time gathering together as a coalition. I'm very excited to have you all here. And we're going to be moving into some introductions in a little bit, just so that you all have a chance to meet each other and to learn who's on this call. But before we get there, I just want to cover our mission as a coalition. The Coalition for Victims of Child Abuse was created to improve the quality and impact of services on child victims and their families. And CVCA provides leadership, vision, and resources to organizations committed to treating and ending child abuse. So with that, I'm going to turn it over to my colleague, Michael Williams, who's going to be speaking a bit about how CVCA connects to the Child Abuse Prevention Center in Sacramento and provide a few opening remarks.
Thanks, Melissa. Hi, everyone. I'm very honored to be able to speak to you. My name is Michael Williams. I am a program director at the Child Abuse Prevention Center in Sacramento. Other work I oversee are the Strategies Technical Assistance Program that works with counties on child abuse prevention plans, and the California Family Resource Association, which is a network of family resource centers, family strengthening organizations, and networks. Our team member, Madison, on the call is also with CFRA, is how we make it an acronym. So I've been involved with CVCA about since 6 months into the grant. And it's been an honor. It's been interesting to see how it's grown, and I'll share some of that in a minute. A reflection it has sparked for me in this conversation, kind of starting this conversation, sparked for me is, so about 4 years ago, when I started working at the Child Abuse Prevention Center, I would tell people where I work, and they would say, oh, that's got to be so hard. That's got to be so stressful. You must really come across a lot of trauma. And I have to then explain, well, the work I do supports the people who supports the children and families in trauma. And so I am, in our programs are in a little bit more of a protected space. So, you know, we feel what folks are bringing to us, but we're not in the trenches like you are. And so I want to acknowledge that you all are the folks who are really being there for the kids and families and taking on what that involves. I know in our past symposia, secondary trauma and self-care have always been a real interest, and we want to continue to be a support around that. For now, I just really want to acknowledge and thank you all for the work you do. There's something else that was interesting in preparing for this, and in the slideshow that Melissa put together, and I'm gonna have a little spoiler alert on the last slide, because the last slide says, thank you, CVCA. It doesn't say thank you from CVCA, it says thank you, CVCA. And we're really committed and clear that CVCA is you all and what we all can make of this coalition together. We were funded by the Office of Emergency Services to promote mutual support and networking, as well as your training and professional development efforts for OES subgrantees. And that's been a learning process. The beginning was, I'm echoing back on myself. I don't know if everyone has their mute on. We were part of the OES workshops, and we adjusted, learned the level of sophistication that you all wanted, and provided some organizational reflections around trauma-informed care. And since then, we've had a couple regional symposia in Sacramento and Fresno and San Diego that has been co-planned by CVCA members and well attended and well responded to. we want to keep that going. That's one of our deliverables for OES, and because it really seems to be energizing and supportive of you all. I've been really excited about having Melissa on board, and the way she's reached out and to have been part of these conversations that she's set up, and excited for many reasons. I think one, witnessed by you all being here, that personal connection, I think is already increasing our sense of shared membership and shared belonging, and we really want to build on that. And then the other thing that has me excited is just to hear from you all. I've been in on just a couple of you on the call, and just how supportive you are of the idea of finding ways to build this network and to build these mutual supports and to work with us on what's going to be helpful to you around professional development. So in the course of today, Melissa is going to, as she said, share the findings, which are pretty affirming of what we've been trying to do, and then also some ideas about where we want to go with it with your help, with what we will provide online, what we provide in terms of symposia, and what we provide in terms of peer connections. And so I'm excited to put all that out to you, and putting it out to you again with that filter in mind that we are CVCA, and we can build this together, and to be a great mutual support. The kids and families you support need you to be supported, and we want to be a resource around that. So excited to be a part of it, excited to be part of today. I will be keeping an eye on chat, so if any side questions come up or questions while there's not a chance to talk yet, please put them in there. I'll answer as I can, or talk about how we'll follow up. But thank you again, and thank you for allowing us to be involved with the great work that you do.
Thank you, Michael. And now we're going to turn it over to all of you. We're going to start off with some introductions. So on this slide, I have a few of the things that we'd like you all to share, including name, your pronouns if you're comfortable doing so, your role in agency, the county where you're based, and the counties that your agency may serve, years of OES or CHAT grant funding, and what you're interested in learning today. To help facilitate this introduction process, I'm going to have our colleague Madison just call on folks, that way we're able to get everyone in nice and smoothly. So Madison, I'll turn it over to you for these introductions.
Okay, first on my list, how about Alma?
So my name is Alma, and I am the program coordinator for victim services in the DA's office in Monterey County. And we serve all victims of crime. I can't really answer how many years we have OES funding. We don't have CHAT funding, but I do know it's 30 plus years. And I'm interested in learning about the findings. The conversation that we had with Melissa was very interesting. So I'm curious to know what everybody else's thoughts and opinions were on child victims.
Perfect. And how about Angela?
Hi, this is Angela. I'm sorry, I had to step away for a minute. Are we doing introductions?
Yes.
Okay. My name is Angela Reed. I'm the Executive Director of Lassen Family Services, located in Susanville of Lassen County, obviously. We are a very small community, and so, yeah, we just kind of struggle along and ride the waves.
Great. How about Angelica?
Good morning, thank you. My name is Angelica Zamora. I'm a psychotherapist with the YWCA in Monterey County. Well, we serve the counties of Monterey County. We work with victims of crime, victims of domestic violence, and I just want to, just learn more about your coalition and just hear from everyone. I think just anything that I can learn will help me better serve, not just my agencies, but the clients that I work with. Thank you.
Perfect. How about Brittany?
Hi, I'm Brittany Vetter. I use she, her pronouns. I am a program director at the YMCA of San Diego County. We do serve countywide. This is our first year of chat funding. We are on our third year of other VOCA funding through OES, but our first year in chat funding. Honestly, this is kind of new to me, so learning what the coalition is, what I think some more of the purpose, what other people might be doing with their chat funding, those kinds of things. That's it.
Perfect. How about Arlie or Arlie?
Is it for Relly?
Yes, that.
My name is Relly Galay. I am part of the counseling department for House of Ruth. We are currently serving, we're currently in LA County, but we serve not only LA County, but also San Bernardino. And I believe we have been under chat funding for close to 13 years. So we're very, very excited to be here and have the opportunity to learn more about the coalition and just be part of this team.
Perfect. Next up is Denise.
Hi, good morning. Denise Wyatt, the Executive Director of the Family Healing Center in Fresno County, actually in the city of Fresno. We have had 5 years of OES. We did have the chat. We currently do not have chat anymore. And I'm interested in learning more about the Coalition for Victims of Child Abuse. I have attended the trainings that the CAPC in Sacramento has put on, which I found very interesting. So that is why I'm here today.
Perfect. Next up is Elaine.
Good morning, everyone. My name is Elaine Bogorio. My pronouns are she, her. I work at Para los Niños as the Associate Director of Clinical Services in Los Angeles County. We are in our 6th year of chat funding. And I think I'm interested in just hearing how everyone uses the funding. I'm excited to be part of a coalition that I didn't realize I was a part of. And I think I learned something new every year about how to utilize our funds. And while it's a very small portion of our funding, the chat funding really allows us to service all of the clients that come through our door. So thank you for having me.
Jessica.
Hi, my name is Jessica Cardenas. She, hers are my pronoun. I am the site supervisor for our victim services program at Lao Family Community Development. We have 2 offices in the Sacramento area, one in the North Sacramento area and one in the South Sacramento area. And then we also have an office in San Pablo as well as one in Oakland. In regards to OES funding, ever since our program has been around, it's been funded by OES, but Kazua, she's the program manager for us, and she's here today. She could probably talk a little bit more about our funding. And what I'm interested, I think just overall, this is my first time being a part of one of these meetings. So I'm just really interested to kind of learn everything about the coalition, what the results were in the needs assessments. I'm always kind of interested to see kind of the trends that we need to address and that we need to be a little bit more proactive on, and then just how we can utilize the grant funding.
Perfect. How about Joelle?
Hello, good morning, everybody. My name is Joelle Vessels, and I'm the Director of Mental Health and Trauma Treatment here at Interface Children and Family Services. We're a nonprofit organization located in Camarillo in Ventura County, been around since the early 70s. And we serve Ventura County primarily. We've had the chat funding It's been a couple of decades, probably before I came in 2002, and OES funding probably before that as well. We also have domestic violence and human trafficking services in another department. And I'm just looking forward to hearing about what the membership role is in the coalition, and actually very excited to see CPRA involved, and learning a little bit more about FRC development in other counties. So yeah, just excited to be here and hear more.
Perfect. How about Kazawa?
My name is Kazua. She, hers are my pronoun. I am a program manager with Lao Family. Our offices serve quite a wide range of counties between Alameda, Contra Costa, as well as Sacramento County. OES funding for Lao Family, thankfully, despite all the decreases that we've seen in VOCA funding, it has been a program that has remained strong with us, and programs that have been continuously funded by OES for, gosh, I want to say over 15 years now. So very fortunate to have these services to continue to serve our underserved communities. In terms of what I'm interested in learning, I think that with the recent reports that have come out within the last several weeks in regards to the decrease in child abuse cases being reported, I think that there is a significant, there's something wrong with how these numbers are derived, because obviously child abuse is not something that is decreasing. And of course, the impact of COVID, I think, is creating those challenges in how those numbers are being derived and who's doing the reporting. So I'd like to obviously hear and see what other individuals are experiencing and how you're handling that within your own organization.
Perfect. How about Kelly?
Hi, my name is Kelly Coane. I'm the director of the Calaveras Crisis Center and the Calaveras Children's Advocacy Center. We serve Calaveras County. We've had the chat funding for about 6 years. We have other OES funding that we've been getting for domestic violence and sexual assault for probably 30 years. I agree there's something wrong with the child abuse numbers that's happening in our county as well. It's like, how can that even be possible? But yeah, that's a whole nother conversation. I am interested in hearing, having that conversation as well, but also the feedback from the assessment. Kind of hearing what other people are dealing with, how they're dealing with things, ideas. It's always good to get different perspectives. So I'm glad to be here.
Great. How about Manisha?
Hi, good morning. My name is Manisha, and my pronouns are she and hers. I'm the Director of Clinical Services with CORA. We serve San Mateo County, and I wouldn't be able to give you the exact number of years that we've been receiving funding, but I know that it's been decades, and thank you very much for that. And this is my first time attending this meeting, and I'm interested in learning more about the coalition and our conversations. And yeah, that's where I'm at.
Awesome. Paula?
Hi, I'm Paula Johnston. I'm the Chief Operating Officer for Plumas Rural Services. We serve Plumas County. We had CHAP funding for about 20 years. Unfortunately, it did go away for this year. We also do domestic violence services, and that's about 20 years as well. I am interested in learning more about the coalition and also the feedback on the assessment.
Awesome. Sorry, how about Monica?
Hi there, apologies, I joined late. I was running late for another meeting. My name is Monica Dedia. My pronouns are she, her, and I am with the Child and Family Center. I oversee our abuse treatment grant. I serve the LA County Santa Clarita area. And this is my first year working with Cal OES. However, our domestic violence program has worked with Cal OES for quite a bit. And I'm just interested to see, the outcome of the surveys and the supports available to promote the success of the programs. Thank you.
Great. How about Rosanna?
Hello, I'm Rosanna Beaumont. My pronouns are she and her. I'm the program manager and supervising forensic evaluator at the Martin Luther King Jr. Hub Child Advocacy Center. We're developing CAC in Los Angeles County. We serve Los Angeles County and sometimes do courtesies for other counties or other out-of-state law enforcement investigating agencies. We've been receiving OES KC funds for 3 years, and today I'm interested in learning more about CVCA and what your assessment findings were and delivery of resources and services.
Great. How about Celine?
Good morning, everyone. I'm Celine Fabiano. I'm the program supervisor at Pathways Counseling Center at Seneca. And I'm sorry, my pronouns are she, hers. And we serve Alameda County. We provide mental health services for children and teens and victims who've been victimized. I believe this is our 6th year of Cal OES CHAP funding. And yeah, I'm really glad to be here. I'm interested in learning what we're learning right now is sort of who makes up the coalition. Very interested in hearing what people do. As Elaine said, it's very nice to be part of a coalition that I hadn't realized until this year that I was part of. And I'm also interested in hearing about how programs have responded to the pandemic and responding now that things are opening up a little bit. Thank you so much.
Great. How about Stephen?
Hi, everyone. Good morning. My name is Steve Carroll. My pronouns are he, him, his, and I'm the Director of Behavioral Health Services with the San Diego LGBT Community Center. We serve countywide in San Diego. We've had Cal OES funding for a number of years, but we are a recent recipient of CHAP funding. So really excited to join you and learn more about the coalition and then the opportunities for us to participate. So thank you.
Great. And then lastly, Taryn.
Hi, I'm Taryn Kearns. Pronouns are she, her, from YWCA Monterey County as well. And I am the grant writing and compliance specialist at our agency serving Monterey County. We've had OES funding for 35 years. This is our first year of CHAP funding, and I'm just here to learn about the coalition and what other organizations are doing in this field.
Perfect. And then that's everybody, Melissa.
Okay, perfect. At this time, we're going to move into the needs assessment. And if you can all just give a reaction, just so that we know that we have your consent. Now is when we're going to start recording. That way we can make this available for members who aren't able to join us today. And then once you have that permission, Madison, if you can go ahead and start the recording, and then I'll move into the next couple of slides.
Yes, I'm recording.
Okay, perfect. So thank you all for those introductions. As you all can see, not everyone was able to join us today, so I'm going to cover a few of the member profiles, just so that you know who was surveyed in this content analysis that I've prepared today. So we had 30 out of 60 organizations represented that are currently receiving CHAP funding. Of those organizations, we had 46 respondents out of 75. We had 20 out of 58 counties and 6 out of 13 first-time CHAT recipients represented. So these are all really, really significant numbers, and I'm excited for you all to see what different members responded to some of the questions that were posed during the surveys. So as you all may know, we conducted these surveys using interviews. So I set up one-on-one times, and I met with quite a few of you that are on this call today. And for those of you that I haven't had a chance to speak with, I'm looking forward to being able to connect with you after this call. That way I'm able to receive your feedback as we move into some of the programming elements. So here on the slide, you're going to be seeing a word cloud, and this was generated from all of the responses that you gave to questions about what you're interested in learning more about. So just for reference, Cal OES gave us some language around themes that they'd like to see us provide training around for this upcoming year. And that included trauma-informed services, voluntary participation in services, nonprofit administration and management, and other issues related to the direct core of the services that you all deliver. So as you can see, a lot of the words that are generated here kind of fit that other category of related topics that speak directly to the work that you do in your communities. So this may be very overwhelming to look at. So what I did for all of your convenience is I kind of condensed them into top 5 categories, which we'll be moving into next. So now that you see sort of the scope of what I've been working with, we're going to move into the top 5 topics of interest. These were not randomly selected. These were all arranged and chosen by the frequency at which you all named them. So I've been able to kind of condense and categorize them so that they kind of capture a lot of what you all were saying. So it may not be exact language. However, I'm hoping that it speaks to the heart of what you all communicated during our needs assessment calls. So with that, the first topic of interest that was the most popular was implementation of trauma-informed care and services. From what I heard, it sounds like a lot of folks are interested in thinking about the practicality of what it means to be trauma-informed and how to carry that out in the services that are being delivered. Next, there was a lot of conversation that I had with you around child sexual abuse, human trafficking, and domestic violence, and the intersections that those all play with child victims. Next, we had cultural competency. I know that quite a few of you work with populations that may not be first language English speakers or may be new to the country. So being able to deliver services from a culturally competent and sensitive lens was important. Next, I had self-care for staff and how to navigate vicarious trauma. I think that this is especially important, especially as we think about what transitioning back to the office may look like. So there's a lot of room to explore what that may be. And finally, engaging families, parents, and caregivers in services. From what I heard, it sounds like sometimes these support systems may be a little bit hesitant or anxious to engage in the services that you're all offering. So finding meaningful ways that they can be a part of this work is very, very important. So that's what I captured from our needs assessments and what sort of the top 5 topics of interest were. However, because this can only capture so much, I also came up with a secondary list of topics that were of interest, which you'll see here, with the first being working within systems, how to work with the law enforcement and the courts collaboratively to make sure that these cases are receiving the care and attention that they deserve. Next, I had working with LGBTQ+ and gender nonconforming youth, how to again serve from a trauma-informed lens and work with youth that may hold these marginalized identities. Next, we had anti-racism, racial justice, and equity. I know that this is a topic that we're all responding to right now, just given the racial injustices that we're seeing on a national level and how to incorporate and apply that to the work that we're doing with the communities that we serve. Next, we had suicide ideation, how to work with youth and children that are contemplating suicide and how the pandemic may be a stressor of that. And finally, a lot of folks express interest in grant writing and funding, how to find alternative sources of funding, especially for those who may be interested in finding other ways to supplement the programs and the essential services that they're delivering. So that is our top 10 list of topics that were of interest. And with that, I also asked questions about how you all preferred to learn and receive and deliver the information that I just covered. So with that, I generated a few CBCA member preferred modalities, and those included lunch and learn sessions. Our plan with that would be to host this monthly on timely topics so that you have a chance to convene, network, and discuss things that are really pertinent to the field right now. Next, we host quarterly symposia. Right now, that would be delivered in a virtual format. That way that everyone is able to join, and if it's safe to do so, I'm holding the possibility of hosting one in early 2022 in person. Next, we've also discussed the possibility of creating an e-library or archive on our CVCA website. That way, if you're not able to join us live for a symposia, you're able to at least still receive that content and also share it with volunteers or other members of your staff that may not be available during the actual event itself. And finally, we also have an online directory on our website, which is for you to connect with each other and just see where you're all dispersed throughout the state. So that's something that we're working on updating, just so that you have the most current information on CVCA members, where they're located, and what services they deliver. And finally, one of the last emergent themes that came up towards the end of these conversations that I had was an interest in members sharing resources among each other. This was something that was brought to my attention towards the end of May. It was something that I was really interested in exploring more with you all. It sounds like so many of you have robust training programs and would like to partner with CVCA in order to promote them within a statewide network. So that lends itself to the question of whether or not that would be another modality or whether that would fit into one of the ones that we already shared before. So that's something that I'd like you all to think about, especially as we begin to discuss more about whether this meets your needs and how CVCA can improve so that we're better meeting those needs. So with that, we wanted to open up the floor for discussion. And these are a few of the starting questions that we had for you all. How does this initial plan meet your needs? If it doesn't meet your needs, how can it be improved? And what will be most useful with respect to content, structure, and convening? So at this time, we just want to confirm that this plan works for you. If it doesn't, where are some areas that we can work towards improving? And what will be most valuable for you all moving forward? If there's any initial thoughts, I welcome that at this time, or we'll stop recording and we can move into some breakout rooms so that you all have a chance to reflect a little bit more deeply and speak with each other about what you all think just about the needs assessments and our plans moving forward.
Can you bring up the list of training topics again, Melissa?
Yes, thanks, Madison. So this is the top 5, and then let me know when you want me to move to the next one. I see that the chat is populating, so if you could just let me know where to maybe move in the presentation, that would be helpful too.
I think from my perspective, this list definitely works for me in terms of my needs, as well as what I envision my program in need of. Even some topics that I didn't think of myself, but I find is also very necessary. So thank you to each and all of you who contributed to this list, because it really did hit every aspect of certain gaps and services that I recognize within my program that could definitely be enhanced, as well as even be built. So I appreciate this list. It's definitely well put together. In terms of, convening and that structure, my goal is to obviously provide as much input as I can to what benefits my staff as well as what benefits the program. So I would definitely appreciate if we could, before these convening, if an agenda could get sent out so we kind of have a perspective of what that conversation is going to look like, or if we even have the opportunity to include some input on what that conversation what we would like that conversation to look like as well, I think would be very valuable in terms of my time as well as what I could get out of it. You know, I find that sometimes when we convene, and I think that's probably why there's a lot of silence, is it feels very formal. And because it feels very formal, that desire to participate, I think lessens because you're kind of on the spot. So I think that having that input prior to engaging in this type of setting via email or even a survey, and just providing that input would be critical, particularly to me, so it doesn't feel so formal or that I'm on the spot.
Thank you, Kazua.
You're welcome.
Is there anyone else that may have any initial thoughts, or would moving into breakout rooms be helpful? I really want this to be up to you how you want to respond to all of the findings. So whatever works best for you all, we are ready to proceed however you all decide to take the lead.
I have been thinking about it that, these are, as Kazal just mentioned, that this is perfect, that, these are the areas. I'm glad that we are kind of labeling them, and then these are pretty much majority organizations that they are serving children and youth. That's the needs. Can we kind of like take ownership of one topic and start work groups and then brainstorm and bring it back to the meetings? So then it's just that, because we gather information and then we all go back to our places and we get busy, things happen, and then things get lost, and we come back. It's just that, so this will give us, this is just my thought, is that some ownership. So for example, I take engaging families and parents, caregivers and services, and we start a work group, and then just work on that and meet, and then set up a once a month maybe meeting, or once every 2 months a meeting, where we all meet and bring back the progress work groups, and what's working, what's not working, and what are the ideas, what has been successful, what is the evidence of that, and what are the areas of improvement, so we can come up with a plan. What is the next step? We can gather all the information we can, but what are we going to do with that? What is our plan, and how are we helping? That's the groundbreaking for us to help each other. Like, Kazal doesn't have to deal with all 5. If my work group is dealing with engaging families and her is cultural competency, sorry, I'm picking because I see you on my Zoom, Kazal, so that's why I'm saying your name, is that then we are helping each other. That's the start, is that, so these are just my thoughts.
Just to piggyback off of that, I think that you bring up, Manisha, a very good point in taking ownership of a topic. I think for me, it's not necessarily an ownership of a topic, but I know where I am, areas where I have expertise in, based off of just the foot traffic, the individuals I'm serving, and the overall years of experience in dealing with that specific topic. But I also know where I am weakest in terms of topics that I know I have no expertise in, and my feedback or even my observation of it might be very minimal, if at all any. So I think I like that idea of that ownership, or just being able to be educated by individuals who have had that experience, whether that be in person, through direct services, educationally, or just years of experience. I think for me, I am not shy to admit where I am in no way an expertise, particularly in engaging families.
I just wanted to say I really appreciate that idea on both parts, because I think it would give us the opportunity to develop relationships with people in other parts of the state that are doing similar work. I know for those of us that are in the little rural areas of California, it's often hard to get to groups where we're meeting. And so the opportunity to meet with other people and hear their ideas and just develop a relationship is sometimes as equally as important as those gatherings one time a year.
Perfect. So what I'm hearing then is almost that maybe that this like work group and maybe setting up groups that are talking about a specific topic and how to bring that back and peer share out might be another modality that might make sense, maybe in place of a lunch and learn. That way that the meeting is more intentional and that you're able to develop relationships. Is that correct? Perfect. I'm going to move it back to our slide with some of the other questions that we had. And if there's still some folks that would like to sit with these questions, maybe now would be a good time to move into breakout rooms just so that you're able to, again, connect, since I know that's a really big part of why we're here, so that you can see who else is a member within the coalition, as well as get the chance to maybe discuss what is coming up for you. And then we could convene again in a few minutes to see what comes up for folks after that. So Madison, would you be kind enough to move us into breakout groups? This will last for about 5 minutes, just so that you're able to touch base with each other and maybe have some conversation about some of the other things that may be coming up or thoughts that you're sitting with. So we'll move into that section right now.
Lisa, I have a quick question. Do we have a directory of all members that, for example, the name and the county and what their role is? So that'll be great for us to not just the emails, just see that. So if we do need to connect with someone, so we know that, hey, I really want to connect with so-and-so.
We don't have that existing right now, but that's something that I can make available if that's something that you'd like to see. So right now on our website, we just have the organization and the services that they provide and a little pin on where they are in the state. But if you'd like to have names and contacts in their role, that's something that I can definitely develop for you all and make available.
So, oh, go ahead.
Oh, no, you go, Michael, you go.
Oh, just a thought before the breakouts. So they've been, along with these questions and the topics that Melissa reported, there have been some great ideas already from members in terms of work groups and how to carry this information forward. So I think thinking those through and seeing what would be good supports for you in terms of how we share information and help you share information would be great to hear from, maybe to explore more deeply in the breakouts and to hear what you come up with.
So it's looking like there's some technical difficulties with these breakout rooms. So it looks like we're gonna have a group discussion, which is always great as well. So we can all kind of hear each other and hear everybody's conversations. Melissa, do you wanna kind of take it from there?
Sure. Thank you, Madison. Apologize about the technical difficulties on our end, but we do have a few more slides after this just to share with you a few of the things that we have on the horizons. I just wanted to provide space for those who may still be thinking about these questions, or if anyone has any further thoughts about it, this would be the time to share. And I hope that you don't feel shy and that you're comfortable voicing that now, since we would love to hear whatever feedback you have just about some of the things that we've heard, as well as what we'd like to set in motion moving forward.
I have a thought. Again, this is my first year of chat funding, but have been with other VOCA funding for a little while. But I'm really interested in even the bullet points that you listed on a few slides back. What are the systemic barriers to accomplishing maybe success in each of those bullet points? So I don't know if this is even possible, but I would love to figure out, with this team, is there influence we can have over the specific details of RFPs, and that maybe we do need more prevention instead of just intervention and treatment, or child welfare services? What are some of the influence we as people who are actually doing the treatment need? What needs to be different in some of the systems that we participate in for us to be successful at our jobs? That's my biggest concern, and I mean, I get all of those 5 bullet points, and we can always do like trainings and things for staff, but I'm almost wondering if we're finding a lot of these commonalities because of more of the commonalities within the system infrastructure of things that are preventing us maybe from feeling successful. So that's my thought. I think we have a lot of power, I would hope, on this call, right? We have a lot of voice, or we have the potential for a lot of voice because we're actually doing the work.
Yeah, maybe I can jump in. This is Celine Fabian. I really appreciate your thoughts, Brittany. I think that makes a whole lot of sense. You know, we should have some power, you know, 60 organizations. So I think, yeah, thinking about how we can advocate, whether it has to do with the RFP program or just for our clients. But yeah, I really appreciate that perspective. I think that could be really useful.
And just to respond to some of the comments that were brought up, thank you, Brittany, for raising that point. Systems advocacy is something that, you know, Cal OES has given us some guidance on, but I think that we also have a lot of liberty in how we interpret that and how we conduct our work. So I think that advocacy is definitely a really important place that I think that we as members could have a really big impact on. So I'd like to further develop what that might look like, especially as we move forward, since you know, trainings can do so much. And I think it's really about how we follow up and how we work to create more equitable environments where we are more on the prevention rather than just the intervention side. So thank you for bringing up that point.
So what I have been thinking is that because I have worked in child welfare for over 16 years in my previous life, what I'm noticing is that in this role in a nonprofit organization providing direct services, that communication with child welfare, that is I hope that they can be part of these conversations too, direct conversations, because they make decisions about the families, their what the interventions, they have so much influence on that. And based on those, we can look at, you know, what can be the preventative measures for families, how can we serve them, how can we guide also child welfare. It's a two-way street. It's difficult to communicate and outreach child welfare because I know, first of all, they're super busy and they're overwhelmed. The system is overwhelmed, but what do they know about? They reach out to organizations when they are in need, desperate needs, but that's not a healthy relationship. Healthy relationship is that when we know who our partners are, who are our neighbors, that's when we feel safe, right? So that's what I'm looking at. For example, in San Mateo County, because I worked in Contra Costa County, and now I'm in San Mateo, I reached out through CAPC. I captured CFS. I'm presenting my organization to them tomorrow, and to the director and to all managers. And the goal is that not just present. What are we going to do with that? How can we have a seat on the table when you make a decision about families who are dealing with domestic violence and child abuse? It's not families who are already in the system, who are on the verge of getting into the system. That's the preventative measures are. And then how to have a conversation directly with the social workers. And then the next step is that how to have a conversation with the foster parents and caregivers. That is the whole point, is that we're talking about the trainings stay with the person who attended the training, but it doesn't translate into the people who are taking care of those kids. They need to be part of the conversations too. So we're all on the same page. So we understand what mom has to do, what dad has to do, what the child is doing, what the caregiver is doing, what the social worker is saying, what the judge is saying. It's just all, and what the nonprofit organizations are doing, what the therapist is doing. So it's just that we need to have that at a deeper level, and that's what the goal is. I had a very good conversation. So luckily I was connected with a great division manager there. But I think that the best way is that to have a child welfare kind of like, be involved directly, or just kind of have more easier communication with them so we can have better relationship with the organization that is very influential on making decision on, protecting kids.
Yes, thank you, Manisha. Well, I'm going to move forward just because we have just a couple minutes left and I want you all to see what is coming up for CVCA. So thank you all for sharing some of your initial thoughts and reactions to the findings. I'm really looking forward to developing some of these ideas that have come out just about the work groups, creating agendas and a directory so that you're all able to further develop these relationships. So I've been taking notes throughout this just so that I'm able to apply and what I'm hearing from you all. So thank you again for your participation and feedback. And just because I had mentioned that we host quarterly symposia, I want to talk a bit more about what that's going to look like moving forward. So we're planning on hosting 4 symposia for each season. So we have summer 2021, fall 2021, winter 2021, and spring of 2022. And spring of 2022 might be in person, just depending on the status of COVID and whether it's safe to do so. However, just because we have planned to host during summer 2021, we went ahead and took some first steps into planning that. So we're planning it for the month of July. And one of our CVCA members will be our keynote speaker, David Love, who was kindly referred by Joelle. And David Love is a licensed marriage and family therapist and founder and executive director of Valley Community Counseling Services. He's an expert on child sexual abuse, which is one of the key issues that many of you are interested in learning more about. So we're really looking forward to hosting him. Once we have some communication back from our OES program specialists, we're going to be sending you all a few dates just so that we're able to plan this for a time that meets your schedules and is accommodating for when you're all available. So that's really the next big thing that we have happening. And then our hopes for the remaining 3 symposia is that you all would be able to serve on advisory committees and really think about how we're going to use that information and apply it. And what I'm hearing you say, Manisha, is really just being able to take what is learned in this training and share it and apply it to the work that's being done. So we really want you all to be involved in that process. And I will actually reach out to convene a group for this upcoming July one, just so that we could think through how we want to use the information that's presented and what might be a useful way of debriefing and using that time together. So that's just our next big thing that we have coming up. We're really excited to have David Love and to have you all be a part of our first virtual symposia. And with that, that concludes our presentation. I just want to say thank you all for carving out the time to be here. It's been a pleasure meeting with you all and connecting over the needs assessments. And I'm really looking forward to continuing to work with you all and support you all in the coalition, especially for this upcoming year as we have very new and exciting things happening. So if you're interested in staying connected with us, we are on social media. You can find us on Facebook and LinkedIn. And with that,
actually, Melissa, I'm sorry to interrupt because my job of monitoring chat, I want to capture something before, because if I answer in chat, we will be shutting down and people will miss the chat. So just Joelle asked, does CVCA have a role outside of Cal OES? I'm thinking about the role of CPEDV in the field of domestic violence and wondering if CVCA has a broader role in the field of child abuse. We haven't yet. We're open to non-Cal OES folks to be members. And I think definitely as we start to talk about some of these systems issues, we can talk about broadening that coalition. So that's worth some exploration. I hope that addresses your question, Joelle. And I'm sorry to talk on top of Melissa's great finish and summary.
That's okay, Michael. I mean, I did ask for someone to monitor the chat. So if there's any other comments or things that are in the chat, I guess now would be the time to touch on those now that we're wrapping up the actual presentation.
That was it. I guess if folks have any other questions, you can email Melissa and myself. And do the connections that are on the screen.
Well, thank you all for your time today. That concludes everything that we've prepared, and we're looking forward to working with you and seeing you at our next symposia. So I'll stop sharing and we'll be signing off. Thank you all.